Hey guys, it's Dr. Justin Marchegiani here. Welcome to today's live Q&A video here. Really excited. Put your comments down below. Really excited to dive in with y'all. And also make sure you give me that thumbs up and that like. Really appreciate it. Hit the bell for notifications. Awesome. So what's happening? Let me know. Would I interview John Campbell? Yeah, I'd be open to that for sure. Barb, I said, hey Barb, hope you're doing well. And that was, I'm pleased to emphasize the danger of the weaker part of the pop. This will be the second wave. If there's a false sense of security, the virus doesn't die, it moves. So yeah, so in general, the second wave, the more we stay in and the more we don't develop herd immunity, the greater chance of a second wave. Now, I'm just basing it off of the last two coronaviruses. There was no second wave. If you go look at the coronavirus SARS-1, or just SARS, I think, right? This is SARS-2-CoV. I think this is just SARS-CoV. It started January 1st, 2013. It popped up April, dropped right back down, and kicked back up again in May, and then it was done, I think, in June. So January kind of to June, which I think is kind of where we're at now. We didn't really do anything at all with this virus. We didn't do any house arrest or anything like that. I do think the more we get antibodies, more people get infected, so to speak, that are healthy, that aren't at risk for any complications. So get healthy, get your nutrient levels up, get outside, get sunlight, still do common sense practices. We always kind of knew, like, if you're sick or if you're around a lot of sick people, you kind of stay away, you wash your hands, you do common sense things. Now we call it social distancing, but that's going to give us antibodies. Antibodies prevent the disease from spreading, okay? So that's kind of smart stuff. That'll prevent a second wave. Again, this is a 96% bat virus. How much of it's made in the lab, we know that's kind of up for debate right now, but because of the nature of it, I don't think we're going to have a second wave. I really don't. I'm hoping with the antibodies that are out there, that'll be protective. And we didn't have a coronavirus vaccine for the last two. We didn't have it for SARS. We didn't have it for MERS. So why didn't we have it for the last two? If it was so easy to do, why didn't we have it for the last two? That's the question that I have. SARS was 17 years ago. Why isn't there another one? Now, it could just because there's various haplotypes of the virus, and it's hard to create a virus when there's various haplotypes. Now, there's people that are doing viruses that are creating these protein structures that look similar to the virus, and that's kind of ramping up the immune system and creating certain antibodies that are kind of more angled to fighting it. So that's kind of a new thing that's happening, where these similar proteins that are pulled out of the coronavirus and they're making it attack that protein. That's something, but we didn't do it for the last two coronaviruses. So I don't know why we'd be able to do it again. I think there's enough genetic mutation in there. Viruses always tend to genetically mutate and become less severe, not more severe. And that's just based off of precedence. That's my observation on precedence. I don't know if that's a set rule or not. I just noticed that you don't see viruses mutating and becoming more severe. Usually the more severe the virus is, like SARS or like Ebola, the less infectious it is. That's kind of it. Like Ebola killed, I think, 40% of people that got it. Like that was a killer, but it didn't spread that much. Harder to spread. Now, I'm not sure if that's a rule either. It's just an observation that I notice. Something I notice. All right, so in general, a couple things I wanted to highlight in regards to the coronavirus front. A couple of studies have come out. One in USC, or one at Stanford, and basically they show that this one talks about why it's hyped. So you can take a look at that study. But in regards to that Stanford study, they're looking at antibodies for SARS-CoV-2, and what they found is 50 to 80 times more people had the infection than what they thought, which is kind of interesting. So it goes over to the study, but the kind of the moral of the story here was 50 to 80 times more, which is quite interesting. And they about 300 people, and that's 50 times as many viral gene tests that have been confirmed. But the moral of the story is 50 to 80 times more people had the infection than actually had come down with symptoms. So let's say you have one person gets the actual symptoms of SARS-2-CoV, aka COVID-19. Well, there's another 50 to 80 that actually had the infection but just didn't show antibodies to it. So just kind of let you know that once you look at the 50 to 80 times range, that drops this virus down below the flu range, FYI. And there's also a USC study on coronavirus antibodies. That's another big one. And you can see here as well, that was in about the same vein, about 50 to 80 times. So testing suggests COVID antibody infection and like greatly exceed documented cases, right? Now, people think this means it's a bad thing. No, because the death rate's the same. The death rate's going to be the denominator, right? The case rate, that's the numerator. That's the top number. So when you look at this, kind of a similar thing, this estimated 28 to 55 times higher. The other study said 50 to 80 times higher. So that puts it down kind of at or even below a flu rate. So just FYI, I'll be doing testing on patients that want the antibody-based testing. I think I saw a couple patients on here that already requested that. So feel free to reach out to my office at office@Justin Health. And if you want, office@justinhealth.com. We'll be doing the IgG and IgM antibody testing for this. So if you want to know if you have that immunity already, feel free. I think the best way to prevent a second wave, the best way to prevent a spread is let people that are young and healthy and don't have any of the comorbidities get exposed naturally, and that's going to prevent herd immunity. As 90% of people, 90% according to the data, are actually having the infection with no symptoms, aka they're asymptomatic, they're developing the antibodies, and they are going to have immunity for a very long time, and they won't spread the infection, which is great. All right, any other questions, y'all? Feel free to let me know. Let's continue to roll through. Randall cycle, fat versus carb competition, if it's a real thing or bogus thing. You need to give me a little bit more context there. Not quite understanding the context of that question. I have a question. I had a GI map done and found a large level of alpha antitrypsin, about 1036. What do you suggest that could be? And that I was a carnivore for about 4 months. Well, I don't recall antitrypsin being on the GI map stool test personally. I don't recall that being on there. There's elastase on there, which is an enzyme marker. Antitrypsin, I think, is another marker to look at enzyme production by the pancreas. I think it's another marker similar to just how your pancreas is doing. I'm looking at it right here. It's a protease inhibitor. I need a little bit more info. I don't know that test to be on that GI map unless it's an add-on, and I typically don't add that on. So give me a little more intel. But it sounds like that could be a marker that's looking at pancreatic enzyme production and how digestion is doing in regarding enzymes. All right, Pink writes in, Judy Mikovic interview, believes coronavirus has been around since 2016, 2017. She thinks the COVID-19 is not caused by the coronavirus. She also recommended deuterium depleted water. I mean, the COVID-19 is a disease, I think, just created by the WHO, I think, in January, right? So this is kind of a new disease that was just created based on the SARS-CoV. Correct me if I'm wrong. So I know that was kind of what the WHO and Dr. Tedros in China they created this name, the COVID-19 name. So I know that's a relatively new name. Now, the COVID-19, it's kind of like HIV and AIDS, right? So the whole idea is they created SARS-CoV is the virus, and then the disease caused by that virus is COVID-19. It's kind of like how we use HIV, and then the disease that HIV causes is AIDS, right? Now, other countries, you can actually develop AIDS in Africa and India and with a lot of malnourishment and not actually have HIV. That's a little side note there. So I think the viruses and the disease are intimately connected on that one. Sleep issues, brain fog, chronic inflammation, fatigue. Have a few OAT tests and stool tests done. Nobody can seem to find a root cause. How else would you look for the root? Well, so you're saying you have sleep, brain fog, and chronic body inflammation. So it all just comes down to your history. I need to know exactly what data came back on those tests, what you've done, what's actually been helped by what you've done, what's been made worse, kind of where's your diet at, where's your lifestyle at. When there's a lot of chronic things, we may look at co-infections or mold. It just depends. It's a loaded question. I need to know exactly what you've done, what's improved by it, just the low-hanging fruit. Not appropriate for a quick Q&A like this. They're saying that the summertime won't help and heat doesn't kill it. Yeah, heat does kill it. That's wrong. I've seen the data on that. They're saying that with 75 degrees and 80% humidity, it's killed within 90 seconds outside. They're all saying there's a second wave currently happening in China. We'll see. We go look at the data here in China. Let's go look at the data in China. I have it right now. There it is. Okay. No second wave right now in China. This is daily new cases, okay? You see a second wave coming up? No second wave. Deaths, I mean, this is just probably this is when they added a whole bunch of deaths on one day, right? They probably just didn't add it right to begin with. So, but you can see outside of that, no second wave. Let's go look at U.S. deaths here. Nice thing here is look at the daily new cases. It's gently sloping, right? You can see that's gently sloping at about a 10 to 15 degree angle, okay? And then, of course, there's always a 2 to 3 week delay with cases and the deaths. And you can see that is, of course, kind of hit the top here right around April 15th, actually. Right here. We had one little pop-up here. A couple of reasons why. New York added a whole bunch of extra deaths after the fact. But that's continuing to gently slope down. And we know there's a 2 to 3 week delay here. And then that angle is moving down as well. So it'll all be done in early May. The temperature will knock it out. A couple of studies I've showed in the past looking at China, and the cities that were hit the least there had the highest humidity and temperature. Same thing, Italy, right? There's the deaths. That's dropping. Remember, Italy's about 2 weeks ahead of us, okay? So we're like right here on the Italy chart, okay? We're like right there. Same thing, UK. They're flattening out with their cases as well, as you can see. And then here are their deaths. They're also heading down nicely. It's a predictable path how this thing rolls. And let's just, for the fun of it, let's just go look at SARS death curve, all right? Here's the death curve of SARS back in 2003. There you go. January, it revs up, right? Revs up in January, hits the peak March 28th, and then there's a little second peak kind of right here. And this could just be a delay in people getting sick and dying, right? There could be a little bit of a delay. But if you look at the general trend, the trend never really stopped. All right. A true second wave would be it's up and then it's down for a couple months and then pops back up, right? So you can see the general trend is still up. Peak is probably end of March, early April, about the same time, funny enough. And then it drops out right there by end of May, early June. So that was SARS, the first one. Okay. And then MERS, I don't think really, there's not much data on MERS. You can do MERS, death curve. I don't see too much on that. I haven't been able to get the death curve on that one. I don't think that really hit that hard here. But see, if you look at the MERS, I can't really find a good data point on that. Yeah, hard to see on that. Okay, let me go back to questions for you guys. All right, keep on rolling here. Best way to kill candida in the sinuses. We've talked about that. Xlear, rinse twice a day, adding some silver the last 2 days. Iodine seemed to make it more congested. Anything else? Nope, just continue to try that. But you got to fix the gut. You got to fix the food. If you have bad air in your home, you should really get a good air filter. Austin Air HealthMate Plus is a great one, is a really good one. Does apple cider vinegar lower potassium in the body? I don't know if it would lower it. It's going to have potassium. The apple cider vinegar has acetic acid in there, which is going to help flush out guanidine, and it does help mobilize minerals. I see a lot of patients that have cramps, and just taking a little bit of apple cider vinegar, their cramps do get better. So it does flush out that guanidine, which is a metabolite from protein, and it does help mobilize minerals. Herbs for staphylococcus infection, and which probiotics to use. So in my line for staph, we'll typically do a GI Clear 1 and GI Clear 4 to knock out dysbiotic bacteria like staph. How can active charcoal help brain fog? It'll help bind up biotoxins. So if you're releasing a bunch of biotoxins or there's mold in the environment or toxins like that, it'll help bind it up and help your body flush it out better. Did a test called the Florinoscan, and it looks for a few things that just things than just the floor. It also looks at calprotectin and other enzymes. Interesting. Would you suggest I'm guessing intermittent fasting for a male with adrenal issues, asthma, sinus issues, age 42, doing low carb already? I'd probably get a little bit more stable, but you could always do a 12 by 12. 12-hour fast would probably be okay. Thanks for your input. The lab that made the test explained shortly that the alpha-1 antitrypsin is a marker for losing protein from the blood in the gut. Okay, so it's a protein absorption marker. Okay, a protein absorption marker. Got it. Okay, very interesting. So we'd always want to look at that as a marker as digestion gets better. We want to see that improve that. That's good. Keep that in mind. I have not seen that marker on that test. Is it an add-on? Did you add it on? Let me know. Staphylococcus, stomach, and skin infection, which herb to use, which probiotic. So in my line, we do the GI Clear 1 and 4. berberine, stamona, dill, procrasma, kutch tree, artemisia, golden seal, right? Those are my favorites. Is dull seaweed good for iodine? Yes, it is. Just be careful you don't have any active autoimmune stuff. Let me hit one other question, guys. I'm having a problem with low cortisol. I have stage 3 adrenal fatigue for 6 years. Recently had a hysterectomy due to a large fibroid. Cortisol has risen and been in a good range for 12 months. Now it's dropped. Any ideas? Well, there's a lot of stuff happening there. So if you just had a fibroid, you got to look at the estrogen dominance that may drive that. And I don't know, where's your diet at? Do you have good digestion? Do you have good gut function? It's hard to say. I would want to do some adrenal testing, some female hormone testing, and look at your gut and just really ensure your diet's good and your blood sugar's good and you're doing all the right things in regarding that. I hope that makes sense. Got to make sure that's all 100% dialed in. Okay, excellent, guys. Very good. All right, any other questions, feel free to let me know. I got to jump on a patient call. Let's see here. What are the best supplements and diet for SIBO? Well, a low FODMAP, paleo, template's a pretty good one as a good starting point right there. Hope that helps. All right, guys, I'll try to be back maybe this weekend. We'll see. If not, I'll be back on Monday. If you enjoy the content, put your comments down below. All right, have a good one, guys. Take care, y'all. Bye.